Hi there, I'm Rebecca Williamson. I'm the publisher of FiercePharma, and I'm here today with Hoss Sooudi, the general manager of EngagedMedia. Hoss, thanks so much for joining me today.
Thank you for having me, Rebecca.
So, can you tell me, what are your pharma clients looking for when they talk to EngagedMedia?
It depends on the client, but generally speaking, our pharma clients look for experience. So what we do and what we've been doing, we're the best at, and we basically invented it in pharma. We've been doing that for over a decade. So that kind of experience and validity that we bring to the table is something that no one else can do. The second, I'd say, would be innovation. We have time and time again, we have our clients who come to us saying, look, we're looking for something that's going to push the envelope and be different than anything else that we've ever done before.
So what do you see as some of the biggest challenges in patient engagement right now?
Today, some of the biggest challenges are really where patient engagement, what's considered patient engagement, and it's come a long way from years past to now, but I think it has a long way to go. And I think it starts with delivering value to the patient first, or the end users, before considering how is this going to benefit my product or us as a manufacturer or other vendors. So I think it starts with delivering value to the patient or end user and going from there, and the success of that is going to be determined as a byproduct of patients really getting and receiving value.
Very good. So how is EngagedMedia addressing these kinds of challenges and industry trends?
Well, a lot of what we offer is based off our Engaged Patient platform, which is our proprietary ability to use data and specific patient level information and then message patients based on what's happening at the pharmacy with their particular brand and their particular doctor. So it's a lot of dynamism and personal approach to messaging and delivering something that's going to be useful to patients first, and then beyond that, making it easier for patients when they have unique issues at point of sale, whether it's a prior authorization or a coverage issue, anything like that may happen at the pharmacy or afterwards, whether it's insurance or others. We have additional modules that we offer that might work for some brands and don't work for all of them. So it's not a one-stop shop that we say our solutions can solve every problem, but we do have some basic solutions, and our engagement platform is that solution. And then building on top of that, we have additional pieces that are focused on very specific problems that major brands tend to have.
So you touched on this a little bit, but what role does data play in all of this?
So we use data in a way that makes it easier for patients to do what they want to do, whether it's refilling a prescription or knowing what's going on at the pharmacy, or knowing exactly who and how much is covered and what's covered and from whom at the pharmacy. So we use patient level data to say, hey, Rebecca, your script at Walgreens, for example, is ready for you at 2:30 p.m. tomorrow, and your doctor, John Smith, MD, may need to write you a new prescription for next month because you're out of refills. That level of using the same data that everybody else has, up to 400 fields of NC-PDP D.0 data, is what we use then to customize an interaction for just you, just Rebecca. And then every other person who comes in using our programs, for all of our clients, has an entirely different interaction than anybody else.
So can you share some examples of the patient experience?
As the example that we were just talking about, if you're an individual who fills a script using our program at a pharmacy, we're going to tell you immediately as soon as it's processed, not when you come back to the pharmacy, but as soon as it's processed, hey, you've got X number of fills left, we'll let you know when it might be due for refill, you saved X number of dollars on your prescription, your insurance covered this many dollars, your out of pocket is this many dollars. That's the level of specificity that we can offer an individual patient, but that's just the beginning. Beyond that, we can say, hey, Rebecca, it's time for you to refill, when it's time for you to refill, because we know when you filled and how much you're using. Beyond that as well, we offer some additional modules, like, for example, RX Surveyor, which is our ability to survey patients based on their unique experience. So if you are in the state of Indiana and you filled at a Walgreens, but you didn't fill a third time, you filled 2 times, we can ask you why and what happened. So that's our very highly targeted mobile-based surveying capability. In addition, we have things like RX Proximity, where we know if your device is within 500 feet of your pharmacy, for example. And we'll create and generate an alert that says, hey, don't forget, Rebecca, you've got a script to pick up at your local Walgreens when you're right near it, and you can pick it up. So these are the types of things that we create specifically for the patient to understand and make it easy for them to say, hey, this is how I can stay on therapy, rather than saying you need to be on therapy, but let's just make it easier for them to be on therapy, and hence how we can deliver a lot of ROI. And we've got many examples like that, but those are just some ideas of how we create a digital and useful experience for the patient.
Yeah, that's really impressive. Okay. So how do you know when it's working? Like, do you have sample results or something to share?
On average, that we have a pretty impressive set of standardized ROIs that we look at to say it's working. But it's not for us whether it's working, it's more so is how well is it working and how can we keep improving it. So we don't just kind of set it and forget it, so to speak. We create a program specifically tailored to each of our clients, and then we monitor it, we watch it, we see how well it's doing, and we constantly look at how we can improve and change that and deliver even greater value, not just to the patient, but also to our clients. And so on average, we see 3 to 5x ROI within 12 months, depending on the drug, so it will vary, but that's our average. And in other cases, we've seen where the timing may be different based on the type of therapy that we're offering. If it's a fill that's once every 6 months versus once every month, right? So a lot of that depends on the indication and the brand and their particular challenges, but what we know works, we've been doing for 10 years. And we know what works because we've constantly been working at it to make sure it delivers value for patients and our clients, but we're also constantly refining that to make sure it delivers more and more value for individuals and brands that we work with.
Okay, very good. So how do you balance personalized interactions with personal privacy?
That's a good question. So a lot of what we do is highly personalized, as we just discussed. But also privacy is an important point, and it's becoming more and more of an issue in many industries. For us, it is something that we put front and center. So it's not something that we try to hide and say, well, don't worry about that, we're going to use all this stuff. We tell our patients in our very easy enrollment, but we tell them up front, hey, this is what we're going to do with your information. And what we find is that when we do that, we say, here's how we're going to use your specific data, your information, and your privacy and how we treat it. We empower the patient to say, I can control this, I know what's happening with my information, not here's how we might do it. And also, we say here's how we're going to use it and why. And so what we do is connect the question of what we're doing with what we're going to offer to that patient and why is that of value. And it's up to the patient to say, is that something I want to do? And generally speaking, pretty much everybody says this is something that's well worth my data and privacy. Yeah.
Very good. All right. So overall, what are some of the new developments or trends that Engaged Media is looking at right now?
I would say that we've got a long list of things on our roadmap and horizon, but of those that I can say today, we're primarily driven by the market and what's hot, and not just what we can sell at all, but really what patients are using, what end users are using, what consumers are saying, hey, this is the way I prefer to interact in a digital manner. So not just, refining our digital wallet capabilities and things like that, it's beyond that. So saying, for example, what platform that we might be able to integrate into next, or what mode, if it's mobile, great, but is it SMS, is it email, where we can make it easier for patients is really what we're focused on right now. But we're always working on innovation. It's a part of our DNA, and looking to see what we can do to deliver greatest value to our patients and our clients. And we find that when we do that, we deliver value for everybody.
So before we sign off today, if our viewers want to know more about your company and what you all are doing, what's the best place for them to find you?
Find us on EngagedMedia.com or contact any one of us.
Very good. Well, that's all the time we have, but thanks so much for chatting with me today. I appreciate it.
Thank you, Rebecca.